Good morning. My name is Cindy Farr, and I am the Incident Commander for the Missoula City County Health Department's COVID-19 response. This is my daily briefing. Today is March 26th. As of today, we still only have 6 cases of COVID-19 in Missoula County, but other areas of the state are definitely seeing increases in their numbers. Today on our briefing, I just want to try and put COVID-19 into context. So over the last few days, we've heard from a lot of people who are really frustrated or anxious, and we understand that this is a really trying time for people. This has become a very big disruption in everyone's lives. Some people want to know, why is this such a big deal? And other people are wondering why health departments have chosen the current approach to trying to control the spread. And the biggest question that a lot of people have is, when is this going to end? So the challenges with COVID-19 is that this is a new disease, and there's a lot of things that we don't know about it at this time. So today I thought I would try and put things into perspective by comparing it to something that we are all pretty familiar with, and that is the seasonal flu. So first, let's talk about some of the similarities between COVID-19 and the flu. They're both respiratory illnesses. They're both caused by viruses. And they're both spread by droplets, which means that people spread the illness whenever droplets come out of their mouth or their nose when they do things like cough. So droplet spread is a lot different than airborne spread. So droplets, it's in the saliva that comes out of your mouth whenever you sneeze or you cough. And with airborne spread, it would just hang out in the air if you're just breathing. So this is a droplet spread disease. And what that means is that if you are in a room with someone and you're farther than 6 feet away from that person, and that person happens to be positive with COVID-19, then that's not considered an exposure, because it doesn't just hang out in the air in the room. It's more like if they cough on you or sneeze on you or onto a surface and then you touch it and touch your face. So we just want to make it really clear that it's not an airborne spread disease. It's spread by droplets. Both COVID-19 and the flu have similar symptoms like fever and cough. But there are a lot of key differences, and I want to talk about some of those differences and the challenges. So COVID-19 is a completely new virus, and what that means is that our population is what is considered naive, and that means that as a population, we don't have immunity to this virus. That means anyone can get it, and since we don't have people who are immune in our community, the usual roadblocks that stop the spread of the disease aren't there, which is what makes it much easier to spread. That doesn't mean that everyone is going to experience the virus in the same way. A lot of people who get it are not going to experience severe symptoms, but there are some who are going to experience severe symptoms. So we want to work together to protect those people that are the most vulnerable. There's a lot of complications in how we respond to this virus because it is brand new and we just don't have as much knowledge as we would like, or that we really need in order to fully combat this virus. We don't have the data like COVID-19 like we do with the flu. So we have to estimate what we think we know about COVID-19 based on what we're seeing to date and what we've seen in other countries, as well as what we know about other previous novel coronaviruses like SARS and MERS. The good news is that we're learning more each day as more research is coming in. We just don't know how long it's going to take for us to know everything there is that we need to know about this. We also don't have the testing and surveillance systems for COVID like we do for the flu. So in a short period of time, scientists designed a test, they got it produced, they got it pushed out to the healthcare system. However, it takes time to develop and distribute the testing resources that are needed. So while we're sitting better than we were at the beginning of this response, we still don't have all of the supplies or the lab capacity or the testing options that we need. We do expect that this is going to continue to improve as the supply chain keeps getting better, but right now there's definitely some limitations to that. Another big difference between COVID-19 and the flu is the incubation time, or the time that it takes between when you're exposed to the disease and when you actually start having symptoms. For flu, it's just a few days, but for COVID, it could be anywhere from a few days to 2 weeks. So that makes it hard because in order to know if you've affected the spread, you have to monitor the cases over several incubation periods. So that means that it can take longer to know if we're in the clear. It also affects our decisions on quarantine, isolation, closures, and shelter-in-place decisions. Um, Unlike seasonal flu, which, as the name implies, has an expected window that we think that we're going to see this virus, um, things pick up in the late fall, they go through early spring. With COVID, because it's new, we don't actually know if there's a season for it or if this is something that's just going to blow through the population until there's a vaccine developed or enough people become immune to it because they've contracted or been exposed to the disease. So that's just one of those really big unknowns. The populations that are affected with COVID-19 are also very different than who are affected with the flu. The populations hit hardest with COVID-19 are older people and those who have heart and lung disease and diabetes or are otherwise immune compromised. While children are a big driver of our flu virus transmission, data that we have as of right now suggests that kids are a lot less affected with COVID-19 than they are with the flu. Children can still spread the virus, but they're just less likely to suffer poor outcomes from it. So here's the biggest and most concerning difference between COVID-19 and the flu. While 80% of COVID illnesses are relatively mild, 15% are considered severe, and 5% are considered critical. So the rate of severe and critical illness from COVID-19 to date that we know of, based on the data that we have so far, are much higher than what we expect from influenza. So these numbers could change as things progress and we're able to get more data on this illness, but that's a big reason that public health has been reacting in the way that we are, and we're trying to really reduce the spread of this disease. Based on the data that we have so far, the mortality rate, or the rate of people who die from COVID-19, is higher than what we see for flu, but more data is needed to really fully understand it. The World Health Organization currently estimates that the mortality rate for COVID-19 is between 3 and 4% compared to 0.1% for seasonal flu. So that's a big difference. It's significantly higher than what we see for seasonal flu. Lastly, the big complication is that there are no vaccines or FDA-approved treatments for COVID-19. So we know that there are a lot of vaccine development in the works around the country. A lot of companies are researching it, and clinical trials are happening as we speak, both for vaccines and for treatment. But we don't know at this point how long it's going to actually take to have a vaccine developed that is effective or an effective treatment. So as you've heard, there are a lot of things that are challenging about COVID-19. The fact that it's new and that we're starting from scratch with a lot of unknowns is really hard. So we appreciate the public's patience as we and others around the world are working on trying to respond to this. We're learning from each other. The big question of when is this going to end is unfortunately one of those questions that we just don't have the answer to because it is a brand new disease. However, looking at how the virus has impacted other countries tells us that it's not likely going to be over soon, and that it could last for months or even longer than that. So I hope that helps to kind of answer some of the big questions that we've been getting over the last couple of days, and to help put things in perspective in comparison to a disease that we really know very well, which is flu. And that's it for my briefing for today. So I will talk to everyone tomorrow. Stay healthy.